Have you ever wondered about squirting? Some people talk about it like it's something incredible, almost like a sign of ultimate pleasure. Others feel confused by it, and some people aren't even sure if it's real or just something exaggerated online. So, what actually is squirting? And more importantly, does it really matter? Hello, I'm Dr. Ella Reed, and welcome back to Dr. Ella Reed Men's Health, where we talk about sexual health, urology, and the real science behind the human body. Today, we're going to break down everything you need to know about squirting, from the anatomy and science to what research says about real experiences. And make sure you stay until the end, because I'll also explain one of the biggest myths that people get completely wrong: understanding the basics. Let's start simple. Squirting is defined as the release of fluid from the urethra during sexual arousal or orgasm in some women. Yes, the urethra, the same tube that carries urine. And that's exactly why this topic is often misunderstood. Many people assume that squirting must be something entirely separate from the urinary system, but anatomically, the two are closely connected. A closer look at anatomy. To really understand squirting, we need to understand what's happening inside the body. Around the urethra, there are small glands called the Skene's glands. These glands are extremely important because they are considered the female equivalent of the prostate. They develop from the same embryological tissue as the male prostate, and they have similar functions. During sexual arousal, these glands can begin to fill with fluid. At the same time, blood flow increases to the pelvic region. Tissues become more sensitive, and the body prepares for orgasm. When orgasm occurs, the pelvic floor muscles contract rhythmically. These contractions can create pressure on the Skene's glands and surrounding tissues, which may result in the release of fluid through the urethra. The role of the bladder. Now, here's where it gets even more interesting. Research using ultrasound studies has shown that, in some cases, the bladder actually fills before squirting occurs and then empties during the event. This suggests that squirting may involve a combination of fluids, including secretions from the Skene's glands, diluted urine from the bladder. This is completely normal and does not mean anything is wrong. In fact, it highlights how interconnected the urinary and reproductive systems are. What about PSA? Scientists have analyzed the fluid involved in squirting and found something very interesting: prostate-specific antigen, PSA. PSA is a substance produced by the male prostate. So why is it present here? Because the Skene's glands function similarly to the prostate, they can also produce PSA. This is one of the strongest pieces of evidence supporting the biological basis of squirting. Squirting versus female ejaculation. Let's clear up one of the biggest misconceptions. Squirting and female ejaculation are often treated as the same thing, but they are different. Female ejaculation, small amount of fluid, thicker, milky appearance, comes mainly from Skene's glands. Squirting, larger volume of fluid, more watery and clear, may include diluted urine plus glandular fluid. Both are natural, and both can occur independently or together. Why media gets it wrong. One of the biggest sources of confusion is unrealistic representation. In many cases, squirting is shown as something dramatic, exaggerated, and expected during every sexual experience. This creates pressure and unrealistic expectations. But real human biology is not a performance. In reality, not all women squirt. Not all orgasms involve squirting, and squirting is not required for pleasure. What research says about real experiences. When researchers actually spoke to women about their experiences, the results were very mixed. And this is important because it shows that squirting is not a one-size-fits-all experience. Positive experiences. Some women described squirting as exciting, empowering, a sign of strong arousal. For them, it was associated with confidence and exploration of their body. Neutral experiences. Others felt that it didn't really matter. They described it as something that just happens, not essential to pleasure, not always even noticeable. Negative experiences. Some women reported feeling embarrassed, worrying they had urinated, concern about mess, or partner reaction. This shows how much psychology and environment influence the experience. The role of the brain. Sexual response is not just physical, It's deeply psychological. The brain plays a major role in arousal, relaxation, orgasm, comfort. If someone feels anxious, judged, or pressured, their experience can change completely. On the other hand, when someone feels safe and relaxed, their body responds very differently. Common myths about squirting. Let's quickly clear up some myths. Myth 1, everyone can do it. Not true. Some women never experience it, and that's completely normal. Myth 2, it means better sex. Also not true. Pleasure does not depend on squirting. Myth 3, it's always a sign of orgasm. No, squirting and orgasm can happen separately. Myth 4, it's just urine, oversimplified. It can include diluted urine, but also glandular secretions. Does squirting improve relationships? Not necessarily. What actually improves intimacy is communication, trust, understanding, emotional connection. Focusing too much on performance or specific outcomes can actually create pressure and reduce enjoyment. So, does it really matter? Here's the honest answer. No, it doesn't. Squirting is simply one of many possible physiological responses. It does not define pleasure. It does not define satisfaction. And it definitely does not define a successful experience. What should you focus on instead? Instead of focusing on squirting, focus on understanding your partner, open communication, comfort and consent, overall connection, because those are the things that actually matter. Final thoughts. Squirting is real, but it's also widely misunderstood. It can be enjoyable for some, neutral for others, or even uncomfortable in certain situations, and all of those experiences are valid. The most important thing to remember is that every body is different, and there is no single correct way for sexual experiences to happen. If you found this video helpful, make sure to subscribe to Dr. Ella Reed Men's Health for more science-based content on sexual health, performance, and the human body. And as always, take care of your health because it truly matters. I'll see you in the next video.